Hello, I'm Dr. Mike. Today, we are going to talk about lumps and bumps. It is not uncommon to find one or more lumps on your dog or your cat. While many lumps and bumps may be benign, others may actually be cancerous. To learn more about lumps and bumps, we're going to meet with Dr. Mona Rosenberg, who is board certified in veterinary oncology.
It's very common for you to feel a lump or a bump, or sometimes many lumps or bumps, on your pets. And it's very important for you to be very aware of what your animal's body actually feels like. Most of the time, these are not going to be a big deal, but they should always be evaluated by your family veterinarian. In fact, what most of us do is keep a map so that you can keep track of any new lump or bump that shows up. My personal opinion is that if a lump or a bump is there for more than 3 to 5 days, it should be evaluated. But should it be cancer, we all know that early detection is imperative at providing better outcomes. The last thing we want to do is just take a wait-and-see approach. Cancer can feel like anything. I can't tell just by feeling a lump or a bump on your pet whether it's benign or malignant. Even if one has been tested, and we know that it's just a fatty lump, another one could feel just like it and be something quite more dangerous. Fine needle aspiration, where we take a small needle, suck some cells out of a lump or a bump, and look at them microscopically, is accurate about 80% of the time in determining whether this lump or bump is benign or malignant. In some instances, your family veterinarian may feel that a fine needle aspirate is not going to give an adequate answer to our question as to whether or not more needs to be done for this lump or bump that we find. The next step is to take a small surgical biopsy, sometimes even just under local anesthesia, in order to get more information. By taking a core of tissue out of that lump or bump, the pathologist now has the architecture of the cells from one to the next, versus the fine needle aspirate where we're squirting these cells on a slide, and sometimes we lose then that architecture. And that can be important in our determining whether this is cancerous or not. As a board-certified veterinary oncologist, having treated pets with cancer for almost 22 years, I find that there's some misconception about the word cancer. Cancer is defined by a collection of abnormally growing cells. It doesn't describe what the behavior of those cells are, only that they've lost their normal regulation, so they keep dividing uncontrollably. That's what turns into a lump or bump. Now, lumps or bumps can be benign, or they can be malignant. A benign tumor is a tumor that if we can successfully cut it out in its entirety, it is not going to come back, and it is not going to spread. If we can't cut it out, unfortunately, it can continue to grow and then cause a deterioration in your pet's quality of life. There are other things that we can do besides surgery, if it's in a location that's not amenable to surgery, such as radiation. Malignant cancers, however, are much more aggressive. And in that setting, even if we cut them out, they often will come back in the same or similar location, or have the ability to metastasize or spread to vital organs. That's when we would then see a deterioration in quality of life. Today, we have made significant advances in the treatment of cancer in patients so that by using chemotherapy, radiation, surgery, and a variety of other oral medications, we can provide your pet with an outstanding quality of life for an extended period of time, regardless of the diagnosis.
Dr. Rosenberg gave us an excellent overview of lumps and bumps. It is important to understand that benign and cancerous lumps can feel exactly the same. If your veterinarian diagnosed a lump as benign and your pet develops one or more similar lumps, you cannot assume that they are all benign. You should bring it to the attention of your veterinarian, who has the ability to examine and to test each to determine if they are cancerous or not. Remember, early detection is key to the best prognosis. I'm Dr. Mike. I hope that this information is helpful, and thanks for watching.